Have you ever wondered about the differences in the various substances your body produces when you have a cough or respiratory infection? It might seem like a simple question, but understanding these distinctions can be incredibly important, especially when we talk about serious conditions like tuberculosis. When discussing tuberculosis, or TB, the primary difference between sputum and mucus lies in their origin and purpose. Mucus is a general term for the slippery protective substance lining your respiratory tract, while sputum is a specific type of mucus that has been expectorated, or coughed up, from the lungs, often containing cellular debris, microorganisms, and inflammatory cells. For TB diagnosis, sputum is the material doctors need to test, not just any mucus. The why here is crucial for accurate diagnosis. Mucus is continuously produced in your nose, throat, and airways to trap dust, allergens, and microbes, serving as a first line of defense. It is usually thin and clear, and while important, it generally does not carry the diagnostic information needed for lung infections. Sputum, on the other hand, is specifically formed lower down in the respiratory system, typically in the bronchi and lungs, as a response to an infection or inflammation. When someone has active TB in their lungs, the Mycobacterium tuberculosis bacteria will be present in this expelled sputum, making it the ideal sample for laboratory analysis. This distinction directly impacts how TB is diagnosed. If a doctor suspects TB, they will ask for a sputum sample, not just any mucus you might clear from your throat. To provide a good sample, you will usually be instructed to take a deep breath, hold it briefly, and then cough deeply from your chest, rather than just spitting saliva or nasal secretions. This ensures the sample comes from the lungs where the TB bacteria resided. Obtaining a proper sputum sample is a vital first step for testing, as it allows laboratories to look for the TB bacteria through microscopy, culture, or molecular tests. In medical terms, obtaining a good sputum sample is often called inducing sputum if a patient is having trouble producing it naturally. This might involve using a nebulizer with a saline solution to help loosen secretions. Another important detail is that the appearance of sputum can sometimes offer clues, though it is never a substitute for testing. For instance, TB sputum might sometimes be yellowish-green or even contain streaks of blood, unlike typical clear mucus. This visual difference highlights its origin from deeper lung involvement. Understanding this difference empowers you to participate more effectively in your healthcare journey. By recognizing that sputum is a vital diagnostic tool directly linked to lung health and potential TB infection, you appreciate why medical professionals emphasize collecting this specific sample. This helps ensure accurate diagnosis and the right path to treatment for conditions affecting your lower respiratory tract.